News coming in from AIIMS that the Delhi AIIMS faculty has asked people who are on winter break to cancel their leaves and return back immediately. This keeping Omicron surge in mind. Meher Pandey is with us for the very latest. Meher, just this morning we were talking about Safdarjung Hospital, doctors there, medics there testing positive, and now AIIMS, in anticipation of this wave which we truly are in middle of, is asking doctors to join back work.
Exactly, Sonal. So from the 5th to the 10th of January, they had winter vacations, but these have been all cancelled now. AIIMS doctors have been asked to rejoin work because they will need as many people as possible, because hospitals are expected to fill up quite fast because this Omicron variant is spreading very rapidly in the national capital and across the country. And AIIMS is, of course, where many people come for treatment. With COVID wards overwhelmed, other parts of the hospital is also expected to become overwhelmed. So this is why the AIIMS hospital is preparing itself for the worst. Remember, this comes at a time when doctors and healthcare workers, nurses are already completely overwhelmed. They had gone on strike very recently because the workforce is already at around 66% of the needed capacity, and they're already overworked now. Their leaves are also being cancelled, of course. This is the need of the hour, but they are paying the highest cost as well.
Right, and Meher, so important to highlight this because, you know, we've heard often very casually from some leaders also, especially from poll-bound states, saying that it's just like a flu, it'll come and go. But the reality is one expert after the other, one doctor after the other saying that the sheer number of people in the country, once Omicron gets truly, gets worse than what it is at the moment, we will see hospitals swell up, and something that we're already seeing in Mumbai, for example, where a lot of the older people and those who are obese and those who are with comorbidities have landed up in hospitals.
Exactly, Sonal. So that's what everybody has been saying from the beginning. Because this variant is very transmissible, we can't discount the fact that it will just spread to many more people. And that makes it much more likely that it's going to infect people who have comorbidities, who will be more vulnerable to severe disease. Because it may have milder symptoms than the Delta variant doesn't mean that more people will not suffer, because more people will get infected.